I've had 13 types of cancer. 2 colon cancers, kidney cancer, 2 different tumors, uterine cancer, bladder cancer, skin cancer on my eye, stomach cancer, brain tumor, non-invasive scalp cancer, prostate cancer, and lung cancer. Well, you always wonder, how much do I have to go through? Why do I have to suffer so much? And it's just continuously on my mind. We moved here in 1987 in June, and it was that August that I went to the hospital. I was having cramping in my stomach. It got so bad to where I was struggling to take the trash out to the street. I would not say anything, but my wife did notice that something was not right and made an appointment with Ochsner to get checked out. They found a blockage, and so immediately they rushed me into the hospital. The operation was a success, and we was in the room and doing really good. And the biopsy test came back with lymph nodes being positive. And that's when I first met Dr. Brooks.
So I started at Ochsner on April 1st, 1987, and I think I met Gerald in 1988. So in 1988, the treatment for a person who had colon cancer, that had the cancer removed, was to do nothing, to do no more treatment. We participated in one of the early research trials that offered him an opportunity to try a new idea at that time, to give chemotherapy after surgery.
If it wouldn't be for Dr. Brooks, I don't think I'd be here. It was just something about Dr. Brooks' presence and the way he talked to me, the way he treated me, it clicked. It's like, and this is the doctor I want.
When you see young patients with multiple different cancers, the red light bulb goes off in my head that something is different here. We did genetic testing on him for a condition that is called Lynch syndrome. Lynch syndrome is a condition where there is a genetic predisposition to certain types of cancers.
This one is Lisa, this one is John.
That was one thing we always wanted from day one, is not to let them be afraid of medical stuff or somebody being really sick or anything like that.
When I heard that they both was positive, I felt really bad, like it was my fault that I passed this gene on to them.
We can focus our screenings at a much earlier age with much more precise treatment recommendations.
I'm hoping that they don't go through the suffering that I've been through all these years. So far, so good with them. And they've been getting tested like they should, and everything's been coming out good so far. This was my last supper.
Yes.
Before my stomach cancer.
In 2013, we went to Mendorf's,
And that's how big I was.
208 pounds.
Yeah, we've been through some tough times, and I know for sure I wouldn't be here without you. You've been so supportive. I love you so much for that.
Love you too.
It's never easy. The day it becomes easy for me to tell someone they have cancer, I probably should stop doing this. And it's very hard for someone who you've known, most of your professional career. But when you have the multitude of cancers that he has, you have to either become resilient and live your life with cancer, or you don't.
When I'm out in my Mustang, it's like some of the best medicine you ever had. You just get out on the road and you just have that freedom.
Gerald has taught me the resiliency of the human spirit. For someone to live his life, to work as hard as he has, and to battle the different cancers that he's had, it's truly an incredible gift that he's given to me.
I hope my story teaches others that don't give up, be positive. There's always hope, and I hope all my suffering can help someone in the future.